Welcome back to ZeroDiabetes Zone. If you're new here, don't forget to subscribe and hit that notification bell so you never miss an update. Today, we're diving into an important topic, diabetes and eye health. Let's explore how you can prevent vision complications and keep your eyes healthy. Diabetes can affect many parts of the body, and one of the most vulnerable areas is our eyes. High blood sugar levels can lead to a range of eye problems, including diabetic retinopathy, cataracts, and glaucoma. But don't worry, there are steps you can take to protect your vision. First, let's talk about diabetic retinopathy. This condition occurs when high blood sugar damages the blood vessels in the retina. These vessels can swell, leak, or even close off, blocking blood flow. In advanced stages, new blood vessels that form can also cause problems, leading to vision loss. Regular eye exams are crucial. Early detection can help manage and treat this condition effectively. Your eye doctor might recommend a comprehensive dilated eye exam at least once a year. Diabetes also increases the risk of cataracts and glaucoma. Cataracts cause the eye's lens to become cloudy, leading to blurred vision. Glaucoma, on the other hand, is a group of eye diseases that damage the optic nerve, often due to high eye pressure. Maintaining good blood sugar control, wearing sunglasses to protect your eyes from UV rays, and having regular eye checkups are essential in preventing these conditions. Now, let's go over some practical tips to keep your eyes healthy if you have diabetes. Number 1. Control your blood sugar levels. Keeping your blood sugar levels within the target range reduces the risk of eye complications. Number 2. Manage blood pressure and cholesterol. High blood pressure and cholesterol can worsen diabetic eye diseases. Number 3. Eat a balanced diet. Incorporate foods rich in vitamin C and E, zinc, and omega-3 fatty acids. Think leafy greens, fish, and nuts. Number 4. Exercise regularly. Physical activity helps control blood sugar, blood pressure, and cholesterol. Number 5. Quit smoking. Smoking increases the risk of diabetic retinopathy and other eye diseases. Additionally, simple eye exercises can improve blood flow to the eyes. Try focusing on distant and near objects, rolling your eyes, and blinking frequently to keep them moist. Don't underestimate the importance of regular eye exams. Your eye doctor can spot problems early and provide treatment options to prevent serious complications. By taking these steps, you can protect your vision and enjoy a healthy life despite diabetes. Remember, your eyes are precious, and with the right care, you can keep them in great shape. Thanks for watching. If you found this video helpful, give it a thumbs up, share it with your friends, and leave a comment below if you have any questions. See you next time on ZeroDiabetes Zone.